The recent statistics released by the State Epidemiology Office show a worrying increase in Lassa Fever cases, prompting an assessment visit by the Commissioner for Health and Human Services to the Benue State University Teaching Hospital. Health workers have been particularly affected. The development, the Commissioner says, points to the human-to-human transmission due to lapses in preventive measures.
We have come this afternoon to see how the response to the outbreak in this facility, the Benue State University Teaching Hospital, the outbreak of Lassa Fever, as we declared in the ministry on the 3rd of February this year. Looking at our epidemiological data, we declared an outbreak. And we've come this afternoon to show our solidarity to those who are on admission in this place and to let them know that they are not alone. The state government is fully behind them, and we are doing everything possible to see that they recover quickly and they get back to their homes. We have also come here to assess the situation on ground, because if you look at the data from the state epidemiologists, about 5 doctors already are involved, and other health workers are involved in this infection. The meaning of that is that it's probably a human-to-human transmission, and the gap in such cases are infection prevention lapses.
Hospital authorities briefed the Commissioner on the safety protocols put in place to contain the outbreak. Residents were urged to follow hygiene and infection prevention guidelines.
What we are doing here now is not just talking to the hospitals, but it's also talking to the public for hygiene, contacts. When you go to gatherings, contact, reduce handshake, reduce contact. A lot of you like shaking everybody. Everybody you say you shake. Time has come when you reduce handshakes, hugging, and other related activities. So we want to advise you, in the hospital now, we have stopped any departmental presentation, any other meetings. We are concentrating on infection prevention. Just like what the Director of Public Health said, prevention is cheaper and better than cure. So if you go around, you see items on the floor. We have brought in spirits, we have brought in face masks, we have brought in latex, we have brought in sanitizers, and we are keeping them at the entrance of every point here now, distributing it around, and then we have an infection prevention team that is going around talking to people on how to prevent. When you go home, also talk to your people. Wash your hands. The clothes you wear here, keep them in the laundry. Make sure you take precautions to reduce what? The spread.
Yes, here at the Benue State University Teaching Hospital, this year has represents a very devastating year as far as Lassa Fever is concerned, both epidemiologically and in terms of case management. As I speak with you now, between January of this year and December, we have recorded 28 admissions of cases with Lassa Fever. This is an unusual trend comparatively from what has happened over the years. This is the first time we are recording admission in tens.
The Benue State Government has pledged to continue monitoring the situation and working closely with health facilities to ensure the Lassa Fever outbreak is contained and public safety maintained.